All right, today's COVID numbers, which we may have sent out electronically just a few minutes ago, 313 new cases of COVID-19. Positivity rate, 3.45%. Kentuckians hospitalized due to COVID, 414. In the ICU, 102. On a ventilator, 47. Now we got one new number that we're calculating, again, to show how new cases are skewing younger, and that's the incident rate. And we have an incident rate of people who are 50 years and older. That is 8.03, but 0 to 49 years, in other words, younger than 50, is 13.41. In other words, it's more than the incident rate is 1.5 times, a little bit more than that, higher for those under 50 than over 50. So we need you to get vaccinated, especially if you're in your 20s or 30s. We really need you to get vaccinated. We're also reporting 8 total deaths today, 5 that have come up through the local health departments, 3 through our continuing audit. The 5 through the local health department, including 84-year-old woman from Fayette County. That's a March death. That's a long-term care death, too. A 65-year-old woman from Harrison County. That's a January death. 78-year-old man from Hart County. That's a March death. 93-year-old man from Henderson. That's a March death. And a 94-year-old man from Nelson. That is February. Of our audit, a 70-year-old man from Boone. That's from January. An 80-year-old woman from Lawrence. That is a January. And a 77-year-old woman from Washington County. That is a November. Another great reason and need to get vaccinated is the variants of concern identified in Kentucky continue to increase. Of the 5 identified variants of concern, we have at least 407 cases thus far in Kentucky. We know it's a lot more than that. 381 of them are the B117, the UK variant, by far the dominant variant that we have seen here, and also likely now the dominant variant throughout Kentucky, like it is throughout the country. Long-term care update. We're starting to maybe see this trending up, and it's of concern. We have 8 new residents testing positive. We have 16 new staff members testing positive, and we have 8 additional deaths. They're not all new. Some are coming from the audit. We're watching this very closely, and we've got the ability through the changes we made earlier in long-term care. When a facility is once again headed in the wrong direction, we have the opportunity to step in and add some additional steps or restrictions if necessary to protect those residents. We cannot let these numbers go up. Far too many have died in these facilities. We want people to have the visitation they haven't had in so long, but we need to see some improvement based on the increase in cases that we're seeing.